Welcome to All Home Care Matters, the show where we discuss all things home care, with discussions on important age-related matters and topics. Brought to you by Enriched Life Home Care Services, the #1 rated home care provider in Michigan by Top Rated Local.
Hello, and welcome back to All Home Care Matters. If this is your first time visiting us here at the show, we want to say thank you for taking time out to be with us today. We appreciate how valuable everyone's time is, and that's why we try and make each episode here at All Home Care Matters something that will hopefully matter to you. Today, we are honored to welcome a remarkable man, Jonathan Cottor. Welcome, Jonathan. How are you, sir?
Very good. Thank you very much, Lance. It's good to see you this morning.
Always good to see you. I know we had a wonderful conversation a couple weeks ago, got to know you, your story, which you're going to be sharing with our viewers and listeners. And, I want to just have you take a brief moment and give an introduction of yourself to viewers and listeners who may not be familiar with you.
Sure. Well, I always like to start with saying that I'm a proud dad. That really the reason that we're talking this morning is the family journey that our family has had with our second son, Ryan, who was born with a life-limiting disease called Spinal Muscular Atrophy, or SMA. It was a life-limiting diagnosis. And he was, when he was born, we started to recognize that he just wasn't developing as a typical kid would. And we had a direct reference because our older son, who was 2.5 years older, was practically running at the age of 10 months old. Ryan was really struggling to sit up unassisted and hold his head up at 8 months old. And at 9 months old, we got a diagnosis that put us on a path to specialists. That got us to a diagnosis of spinal muscular atrophy. This was 24 years ago at this point. Back in those days, there were no treatments and no cures. And really the news that we were given was take them home, love them, don't expect them to live to 2 years old. There's nothing you can do. And that's really when our world shattered. Professionally, I am a consumer marketer. That was my career for 30 years. My wife and I have been married now for 33 years, and we're an Arizona family. But our life really took a drastic turn when Ryan was born, and at that time, coincidentally, we happened to be living in London, England. So there's a lot of things that we'll talk about London and our experiences that have really driven me to the work that I do today.
Wonderful. And I just want to mention, and I hope I'm not stealing your thunder, for those watching, you're actually sitting in Ryan's room, just as it was, talking to him through the gaming system that you and he had built, which I just think is incredible. But, I want to, kind of talk about Ryan now, Jonathan. And, Ryan's arrival must have really changed everything, as I'm sure families that have gone through, having children and, different challenges and stuff can appreciate. But can you share about his diagnosis and how it affected your vision of the perfect life and the way your family was able to adapt to that?
Yeah, absolutely. One thing that I didn't mention in our last conversation is that I'm adopted. So I don't know my biological history. And so when my wife and I were a newly married couple, again, 33 years ago, and we decided to start our family planning, we kind of went into that in the unknown. And our first son, when we were pregnant with our first son, Ethan, who's now 27 years old, he actually had, during one of the scans, during Ethan's birth or pregnancy, when Holly was pregnant with him, is he had a shadow on the heart and a extra fluid in the liver. And that combination meant that he had a 1 in 200 chance of Down syndrome. So we were really, our attention was raised. We were very scared for Ethan's diagnosis. We ended up having an amniocentesis. That ended up proving that he was going to be fine. We had the birth. Life was good. So jump ahead 2.5 years later when we decided to continue our family. At this point, our Arizona family was living in London, England. It was a 3-year job assignment for the company that I was working for at that time. We didn't give Ryan's birth a second thought. We thought we were already through the stress and the strain of a challenging child. And so Ryan's birth was perfect. He was a very calm baby. He had a perfect APGAR score, 10 fingers, 10 toes, beautiful baby. And so we thought, great, life is going to resume. Well, then 8 months into his life, I think my wife really had inclinations that something just wasn't right. But my parents had traveled from Phoenix to London to visit us for the holidays. My mom held Ryan, which she hadn't done in a long time then, and she immediately teared up, looked at my wife, and said, "I'm so sorry." And that was the confirmation for my wife that her feelings were probably true. And that was then put us on a path to specialists. And like anybody, Ryan's diagnosis of spinal muscular atrophy is a rare disease. We had never heard of that disease. We had no idea what that was about. We were not expecting that at all. And honestly, we're 11 hours away from the closest family member, all back in Arizona. Right. So Ryan's diagnosis that put us on a path to specialists. Ultimately, very quickly, he had a muscle biopsy that confirmed that he did have spinal muscular atrophy. And just the devastating news at that time was no treatments, no cures, nothing you can do. And I'm a business person, and I'm used to tackling big challenges. I'm used to having a vision. I'm used to project managing. I'm used to kind of let's fix things, let's do things, let's grow the world. And so it was just really hard for me to personally understand when there's nothing we could do.
Right.
Yeah, it just was devastating news.
Yeah. And you were, in the UK at this time. So when you went there, I'm just envisioning, with my children, did you already find a new, pediatrician, or was that the catalyst for finding one once this happened?
Well, I mean, the national health system in England,
Right.
there's a lot of, we could be a poster family for the NHS. It was a fantastic system from a medical perspective. Holly's birth of Ryan was done through a local village doctor and ultimately at a hospital. And so everything was great. And then when we ultimately needed to go to the specialist, coincidentally, if you're ever going to have a child with a diagnosis of SMA, the best place in the world to go through that experience happened to be London, England. At that time, 24 years ago, the foremost expert on SMA was at Hillingdon Hospital, which was the hospital that we went to and got the confirmation of the diagnosis. So unfortunately, there was nothing, you couldn't question the diagnosis. It was true and it was accurate. But then there was nothing you could do about it. So then we're basically living life. And Ryan's care got very intense very quickly because as the disease is called spinal muscular atrophy, what that meant is that we needed to start doing a lot of physical therapy with him, because if we didn't constantly be moving his joints, meaning his ankles and his knees and his arms and his elbows and his wrists, those would atrophy and they basically would just stiffen up. So we were constantly trying to keep this kid moving, and he didn't have the strength to move himself. So he really needed a full-time adult caregiver for all of his movement, if you will. He had what nature took away from his body and his strength really put into his mind. The kid was wicked smart, very verbal. You couldn't shut the kid up. He was awesome, just had a glow about him, but he physically needed an adult around him for all of his daily living needs. So care for Ryan became very quickly a lot. Ryan couldn't turn himself while he slept. So as most people will toss and turn throughout the night to get comfortable, Ryan couldn't. I mean, you put him on his back and he'll stay on his back. So an hour and a half into his sleep, he would cry out, and one of us, my wife or I, would come into his bedroom, flip him onto his side. Another 45 minutes would go by and he'd cry out again. And one of us would have to go back into his bedroom and flip him on his other side. So it just was a constant, that became our life. And it just became very exhausting very quickly. So we really were desperate for help. And again, 11 hours away from the closest family member, all in Arizona. And that's when a physical therapist that we were seeing now regularly recommended that we go visit a place called Helen House, which is was in Oxford, England, which was 45 minutes up the road. But it was described to us as a children's hospice home. And so our mindset was hospice equals death equals dying. We don't want to go there. We rejected that idea. And we said, no, we have to find hope. We have to find a way to kind of help this kid. We're not going to go and give up. We're not going to do hospice. We just really were misunderstanding what that whole concept was about. We didn't know. And so after months, the physical therapist just kept saying, hey, you don't understand. This place is to help support your family along these very difficult journeys. It really is a place for living, not a place for dying. We really think you should go check it out. And so we finally said, all right, stop bugging us. We'll go visit it. And when we walked in the door, it was, our shoulders immediately came down. It was just, not what we expected at all. It was literally a home away from home concept, a very large home. It was a blanket of love. It was really staffed with nurses and caregivers, and we got to interact with other families whose children had life-limiting journeys and were going down these paths the same. And it just was immediately comforting.
Yeah.
And so that became very important part of our care support while we still lived in England for the next year and a half.
Yeah. Well, I want to kind of talk about that for a little bit more, Jonathan. What helped to shift your understanding, and how did that experience impact you? Because ultimately, this changes the trajectory of your life and even Ryan's life from that point forward, did it not?
It very much did, without conscious intent. I mean, we did not, this was all about experiences, and this was really about organically just kind of living in the moment and literally trying to just get through day by day, hour by hour. And so, again, as we said, when Helen House was presented to us, we immediately rejected it. We eventually kind of warmed up to the idea of, okay, let's go at least visit the place that everybody is saying is so great. We went and saw it. And to give you kind of a virtual mental tour of what our experience was, is we walked into a very large home, so 12,000 square foot large home. It had 8 children bedrooms, 3 family suites, and then it had a lot of specialty rooms, like it had an art room, a sensory room, because a lot of the kids that are being supported through Helen House, and it's about the kids and the holistic family, the entire family. But sometimes those kids are nonverbal, and so basically textures and lights and stuff are very soothing or can be really interactive for those kind of children. My son was able to very speak and stuff. But then it had an accessible playground. It had a hydrotherapy pool. And so what we found really helpful was that it provided overnight respite, literally a chance for us as a family to stay at this place called Helen House. My wife and I would stay in one of the family suites. Ryan would stay in one of the children bedrooms, and we could literally get a good night's sleep because we trusted the team, the nurses and the CNAs, and then they have a child life specialist and social workers and chaplains and volunteers. And it just was all designed to support our family. And so we said, okay, we're going to allow you to care for Ryan while we are across the hall in the family suite, getting a good night's sleep with our older son, Ethan, who was very welcome to be at the house with us. And that was great. And that's what we needed. I absolutely, I've been now in the work that I do, I've been around a lot of families whose children have died, whose children are diagnosed with rare diseases. And I absolutely believe that the number one thing that any family in this kind of situation wants is a cure for their child. The number one thing that any family wants is to cure their child of whatever affliction or disease or diagnosis that child now has. I would still absolutely wish that there was a cure for SMA, and there still is not. There are some treatments, but no cure. I believe the second thing that those families wish for is sleep. Just an opportunity to catch up on sleep during this very exhausting, stressful journey so that they can basically recharge, reconnect with their spouse, and just start to tackle the next challenge and the one after that. And this place gave us that opportunity in a very trusting environment. After we stayed a couple of times at Helen House for a few days, we then really became trusting of the team so that we were able to then have Ryan stay at Helen House by himself. And then my wife and I were able to go back home to our own beds and really catch up on sleep. And this was for 3 days, 4 days at a time, maybe a week at a time. We could spend time as our protecting our marriage, which was really hard to do at that time. We could spend time with our toddler son, Ethan, who was a very active, growing child at that point as well, and create some sort of normalcy in his life for himself. And a family would get up to 28 days a year, 28 nights a year, at no cost. And so we didn't pay anything for anything to stay and get the benefits of Helen House. What people often think, it's not a babysitting service, so you can't just drop your kid off for a couple of hours to run some errands or get a date night, which are very important for families like ours on these journeys. But this is about true overnight stay. So the minimum stay is 48 hours, up to 7 days in a row, up to 28 days a year. Places like that want to connect with families the moment they find out they're on this journey, provide that overnight respite, but also what's called palliative care support. And that's really about terms like psychosocial and emotional support. So that's really because the family journey is so stressful, so tense. Marriages become broken through these journeys. 90% of families going through these kinds of experiences end in divorce. That's where I'm very proud to say that my wife and I have been married for 33 years.
Congratulations.
Yeah, well, and my wife and I look at each other today and say that isn't necessarily 33 years of wedded bliss. I
Right.
mean, we had some very difficult, very stressful times in our marriage, and we're really close to divorce a couple of times. And I think that, and we'll talk a little bit more about that as we go, but it was really the caring of Ryan and the journey of Ryan and what we ended up doing with Ryan House and some of the other work that really kind of held, that was the glue that held our marriage together. But it was, anyway, it's just a fabulous experience.
No, thank you for sharing that, Jonathan. Well, fast forward a little bit, you guys return to the United States and you find nothing after finding this wonderful resource at Helen House in the UK. When you came back to Arizona for Ryan's, what would have been it was his second birthday.
Right.
What did you guys discover about the lack of support for families like yours?
Yeah. So when Ryan was born, and then we started to get referred to Helen House, and then we started to benefit from the care at Helen House, that was about another year and a half that we were still living in England. And as we were now trying to figure out, okay, we're now approaching Ryan's second birthday, which was a date that we never thought that we would get to. We're trying to figure out life. And professionally at that time, the company that sent our family to England was the Pillsbury Company. So I was a senior marketer for the Pillsbury Doughboy. I say the Doughboy sent us to England, but during that time, General Mills bought Pillsbury. And so I say the Doughboy sent us to England, but Betty Crocker brought us back.
Okay.
And so, because of those two major corporate entities, both being based in Minneapolis, a lot of the champions that knew me, that had sent me to England, were let go of the company. And so, our choice really was to come back to Arizona. That became kind of clear. And we decided, okay, well, let's get back to Arizona before Ryan turns 2. We'll surround him with love and family, and then I'll get a job and we'll figure out life again once we're back in Phoenix. So we did that. On our last stay at Helen House, we asked the team, because we'd now been staying at Helen House a number of times. And so we'd asked Helen House team, okay, how do we continue this kind of care support in Arizona? And they looked at us and they said, yeah, no, we're sorry. There just are none of these kinds of care models in the United States. At that time, there were 54 of these kinds of community-based children's respite palliative hospice homes across the United Kingdom. It was a very mature, very established part of how medically fragile children and their families are supported in England. But in the United States, there were literally none of them.
Wow.
And so we said, well, that stinks. There's nothing we can do about that. We came back to Phoenix, got a job I was a director of marketing at a dental pharmaceutical company. We started to get connected to the local children's hospital and the specialists and Ryan's care, and life kind of resumed. We did celebrate Ryan's second birthday, and then, quite frankly, a third birthday and a fourth birthday and a fifth birthday, and the kid kept going. If he was here today, he would describe himself as moldy cheese, way past his expiration date.
Okay.
But it, but when we landed, about a year after being back in Arizona, my wife started passionately talking about our experiences at Helen House through family and friends. My dad was a child psychiatrist. My mom was a psychotherapist. I'd grown up in Phoenix, so there was just family connections here in town. And a conversation ended up happening with Phoenix Children's Hospital and Hospice of the Valley and some other community healthcare leaders. And we started to kind of, basically a group started to rally around my wife. And including myself. And our intention was never to do something like this, but was really to encourage another bigger organization to say, hey, look, we really need something like this in Phoenix. Something like this needs to happen. Well, community meetings started to happen, and basically everybody kind of agreed. They said, yeah, we can't believe that our community doesn't have something like this. We really need to do this. My wife and I drove home from one of those meetings, looked at each other and said, I think everybody's telling us we need to do this. I guess we're doing this. And so that then became the tipping point for us to decide to incorporate Ryan House. We took the leaders that were starting to kind of rally around us. They became our first board members. I'm the one that filled out all the 501c3 paperwork to become a nonprofit. I was the first board chair of Ryan House. And we just started kind of raising money. And we just, this was 2004. It took us 6 years to rally this community to ultimately raise enough money to finally put a shovel in the ground and open up Ryan House in 2010. But when we started the project in 2004, there were literally none of these programs in the United States. And as we started to formalize, I'm looking out into the US going, come on, that can't be, there has to be somebody else trying to do this. And I discovered a program called George Mark Children's House, which is in a suburb of Oakland called San Leandro, Oakland, California. They were also inspired off of the UK model. The founder of George Mark and kind of how they started, it was they had heard about the UK model. They decided they were going to start something very similar. And so as a marketing person, I was doing a lot of traveling back in those days. I had an opportunity to go to a business meeting in San Francisco. I went over the bridge to Oakland, visited George Mark while they were laying the carpet. So I literally have been around this movement in the United States since the beginning. George Mark opened its doors a few months after Ryan House Incorporated. So they were now open in 2004. We started our project in 2004. It took us 6 years to raise the millions of dollars to put a shovel in the ground and actually open the house in 2010. And then Ryan House became the second one of these UK caregiving kind of models that provides overnight respite, palliative care. And then when and if a child does need hospice or end of life care, this becomes the natural hospice place. But it's not about death and dying. It really is about living life, even though those lives may be short.
Yeah, absolutely. Jonathan, I want to stick with Ryan's House for a little bit. When you and I originally spoke, I mistakenly started assuming, Ronald McDonald's house. But just for our viewers and listeners, because there's probably going to be others that might be making that leap like I had, sure. Explain why this is not like the Ronald McDonald's house that people may be familiar with here in the States.
Yeah, it's a fair comparison because I think Ronald McDonald House really has done an excellent job of awareness creation. They've been around. They are a fantastic organization. My wife and I have actually, with Ryan, stayed at a Ronald McDonald House when Ryan was doing a clinical trial in Salt Lake City. And the reason we stayed at a Ronald McDonald House in Salt Lake was because Ronald McDonald House is a home away from home. It is a beautiful structure, usually next to or nearby a children's hospital. It is really intended for the mom and dad or the parents or the caregivers to stay at while the child is being cared for at the hospital. And so it's really a home away from home environment, like a glorified hotel, if you will, because the parents might be staying there for days or weeks. It is a subsidized, so that it doesn't cost very much. It could be free, or the Ronald McDonald House will ask for a nominal donation if the family is able to do that. So it's a beautiful concept, but it really doesn't provide care in the house. Whereas a Ryan House is basically the flip of that. Mm-hmm. We care for the child so that mom and dad get a break. So the experiences at Ryan House is, yes, it is a home away from home. It has more specialty rooms like the art therapy room, the music room, the sensory room, the hydrotherapy pool, the fully accessible playground, because this place is built from the ground up to serve the child and the family. So the family can stay there in one of the family suites, or what often happens during respite stays is that the parents finally, they get to a point of trusting the team so that they can go home into their own bed and sleep. And so it's really, there's a lot of amazing organizations out there supporting families, and everybody kind of does their own thing. So it's besides home away from home, there really are very distinct differences between what a Ronald McDonald House does and what a Ryan House type of concept does.
Yeah. Thank you for clarifying that.
Sure.
Let's talk a little bit more about the birth of Ryan House, because, how did you initially go from that realization to actually founding the Ryan House, and what role did visiting George Mark Children's House really play in that?
Yeah, well, like I said, we were benefited because our family, my wife Holly and I, and our family with Ethan and Ryan, had direct experience with Helen House. That's the world's first. Helen House started in 1982. It was the first children's hospice in the entire world. This concept, home away from home, community-based model. There are 54 of these in England. There are 7 of these in Canada. The first one was Canuck Place up in Vancouver. That then spilled down. That's kind of the project that inspired George Mark And the team in California started to understand and learn more about Vancouver, which then brought them and linked them back to the UK. So the mothership really is the UK. That's really the model that we're trying to emulate. So when my wife and I started Ryan House, our goal really became to bring Helen House to Phoenix, nothing more but nothing less. So we were very clear on our boundaries. George Mark became kind of a sister organization in the sense that we were both doing innovative things in the United States at the same time. But one of the things that I was very clear to our board about is keep your eyes on Helen House in England. Our goal is to bring Helen House to Phoenix. George Mark is doing their version of it and their iteration on it, which is very similar. So that's an amazing organization. But our model was not George Mark. Our model was Helen House.
Mm-hmm.
And their model was Canuck Place and also Helen House. So ultimately, today, both of those programs offer very similar services to families. And that's kind of how it all started.
Yeah. In looking at the bigger picture, over the years, I know you've seen other communities that have tried to open similar homes, and oftentimes they're struggling. What were the patterns that you noticed, and why wasn't there more of a national effort yet?
So what we quickly discovered as we were trying to build this children's program is that the United States is really designed, the healthcare system in the United States is really designed for adult healthcare. Everybody is going to be born, everybody's going to age, and by far the majority of people are going to grow old and ultimately have healthcare issues as they age, be it dementia or just aging or lots of things that's what everybody expects as the normal course of life and the lifespan. And that's why the US healthcare system is really designed for adults, which means that a lot of our healthcare facilities are licensed and reimbursements, Medicare and Medicaid, and healthcare insurance is all designed to really support that kind of a system. Well, now you take a children's program that really starts with a child, a medically fragile child. So thankfully in the United States, most kids are born healthy. They go on to live awesome lives. But there are 1%, less than 1% of all children will be now diagnosed with a complex or very significant medical fragile condition. Like Ryan, it could be a pediatric cancer, Duchenne's muscular dystrophy, severe cystic fibrosis. It could be, or emptying thousands of rare diseases that are out there. That less than 1% of kids is a needle in a haystack kind of population. So it's understandable that the US didn't really design a healthcare just for that few kids. The reality, though, is that those kids are insanely expensive. Mm-hmm. Those kids, that less than 1% of kids will incur over a third of all healthcare dollars spent on children. My son, for example, drove a $65,000 wheelchair. When he did get he had a $250,000 spinal rod surgery when they ultimately inserted a rod into his back. And just to kind of help the audience understand, my son lived for 17 and a half years. So he was not expected to live to 2, but he lived for 17 and a half years, died now 6.5 years ago in December of 2018. But during his 17 and a half years, I mean, it was millions that was spent on this kid between injections and surgeries and emergency rooms and healthcare and nursing. And just thankfully, we had a Medicaid system in Arizona that was able to support our system. But when you're trying to open a house like this, there just is not a healthcare license that is designed to provide this holistic level of family support. And so what ends up happening is that the programs that are trying to start end up relying a lot on philanthropy and charity donations. Ryan House in Phoenix was thankfully extremely successful at doing that. So the people, not because of my wife and I mean, we didn't have when we started, we had no vision or no thinking that we were going to even do this nonprofit. Thankfully, the people that started to surround my wife and I in those early days were very experienced, very passionate community leaders that understood how to build nonprofits, how to connect these to the community, how to really build a very structured, methodical, deep, broad base of charity support. So Ryan House raises $3.5 million a year, every single year out of the Arizona community so that families don't have to pay anything for the services that they receive. That's fantastic for the Arizona community, but that's really hard to do every single year. Ryan House has no debt. It is very successful because it is such a good and strong. The board, the executive director, the team knows how to raise money and they're really good at it. Most communities struggle to do that. And so, where that's really the key breaking point. So, if we want ultimately more of these kinds of programs across the country, which is really what our national center is all about, and our Children's Respite Homes of America is about scaling and strengthening those kinds of momentum and growth in those programs, we need to tackle the fundamental issues of healthcare licensing and reimbursement. And that really gets into policy and advocacy work and legislative kind of a work, because we have to reframe the way that the U.S. thinks about children's healthcare and the way we support the system. We have to really reshift the system to think about children's healthcare, support the entire family, and design licenses that allow these kinds of community-based programs to open and to connect to appropriate levels of reimbursement so that these programs can be sustainable. There's lots of people like my wife and I that would love to open up a program in Michigan where you are, or in other places. In fact, we have 3 groups in Michigan that would love to do this. The problem is Michigan doesn't have a healthcare license to allow them to do this. Right. So we have to go into Michigan healthcare laws and help change that. Otherwise, you're going to take a license that exists and duct tape and Band-Aid it, and you're going to have gaps in care and low reimbursement rates, and it's a mess. So we got to fix all this.
Yeah, no, we agree. And if there's any way we can help those groups here in Michigan, just let us know and we'll do what we can. Yeah, I want to, talk about, Ryan's death and how that was really a turning point. Yeah. How did Ryan's death reshape your focus? And it ultimately led you going back to school for an MPH and then ultimately founding the National Center for Pediatric Palliative Care Homes, the NCPPCH, and its flagship program, Children's Respite Homes of America.
Yeah. As I mentioned, we never expected Ryan to live to 2. He lived for 17 and a half years. He had an awesome life. Very challenging. It was very exhausting, but it was awesome. And so one of the first things that you mentioned when we started talking was the background and where I am. This is Ryan's bedroom. I love being in this space. This is where Ryan lived. This is not where Ryan died. And so when I started doing the work that I do now, I started to blur out my background, thinking, all right, maybe the posters, the Marvel posters and Doctor Who posters are not so professional. And then I'm like, you know what? That's who I am. Ryan is clearly my North Star. He definitely drives my passion, my fire, and doing what I do. Well, in Ryan's 17 and a half years, as Ryan House began to take shape, it opened in 2010. I was still a board member. My wife and I were very active in the community in terms of the fundraising efforts. We're still a very strong presence at all the Ryan House events. I'm still now a director of marketing, eventually became a vice president of marketing at a company. We've got a growing toddler who's now going to 8th grade in high school himself and now learning to drive. So we had a lot of family kind of, things to kind of care for. Well, across the country, as these other communities were trying to kind of get similar type programs going, what ended up happening is that we would get together as a informal kind of coalition. George Mark Children's House did an awesome job of creating an opportunity for these houses to kind of connect every couple of months through a conference call. And what ended up happening was this group kind of kept yearning for national leadership and saying, wouldn't it be awesome if someday we had a way to kind of collect and share best practices and inspire each other and try and help this momentum grow? But nobody was willing to step up and do that. I wasn't willing to do that either because, again, I had a professional career. I was still very involved in local Ryan House. We're still trying to raise our family. Well, then Ryan died, and that changed everything for me. That hit me extremely hard. Yeah. When Ryan died, he was halfway through his senior year in high school. He was ready to already go to Arizona State University. He wanted to live in the dorms. He wanted to study graphic design and video editing. And that was going to be a really challenging transition for us that was going to happen about 6 months later. But we were figuring it out and prepared for it. Unfortunately, Ryan, on this Wednesday morning, went to high school as he typically did. It was a public high school. He was kind of king of the school. There was a human error at the school during a transfer. His neck came down, cut off his air supply, and put him into a medical coma. He ended up being ambulanced to the hospital here in town, and within 2 days, he just died. It was horrific. It was brutal, and it was unexpected. We knew that Ryan's body was getting weaker, and we thought we were going to have a difficult winter with conversations about possible tracheotomies and G tubes and things, which Ryan did not want to have. So we thought we were preparing for some difficult conversations, but ultimately Ryan didn't need to die the day that he died, and so that was really a traumatic, hit us hard. Immediately, my wife, as you would expect, went into like a fetal position and just mad at everything in the world, and for me, I also was obviously hit hard that the moment of, but because I'd been around so many families and around children's death and dying, my the way I describe it is that my logical mind was managing my heart. And that wasn't meaning that I was trying to suppress feelings. It was actually the opposite. I was allowing myself to say, look, I'm going to be sad. Feel whatever you need to feel. It's okay. And so literally, Ryan's death, I'm crying all the time. I'm fine with that. If I, was working with, and I was like, hey, I need to pause. It's hit me. I just need to cry. I need to take a moment. And I thought I was doing a good job of just allowing my body to feel whatever I needed to feel. Well, about 6 months after Ryan's death, my wife and I had an opportunity to go do a little holiday in Chicago. It was a city that we really have enjoyed over the years because Ethan was out of the house and Ryan had died. So we're like, all right, we're adults, empty nesters. Let's go play in Chicago. And it was in Chicago that my wife and I are walking around the city and I hit boom, my low. All of a sudden, just my emotions just went rock bottom. And I was talking to my wife saying, I am so frustrated at the US healthcare system. I need to get back to my people. Because what happens when you have a death of a child, Ryan's care was so intensive. We had nighttime nurses coming into our house 5 nights a week. We had all this work that we were doing with Ryan House. We were going to specialist appointments and physical therapy appointments, and there was just so much coordination around Ryan's life. And then when he dies, boom, everything goes quiet. It immediately stops. No more nurses coming into your house, no more appointments, no more anything. And that quietness is just deafening. And so it was after, that's really, I think, what hit me 6 months later when I'm like, I got to get back to my people. I have to find a way for myself to thrive. When was I happiest? When was I really feeling like I was doing something of purpose? And I was talking to my wife and I said, for me, it was really, I loved creating the next flavor of soap and marketing that. And I loved my corporate marketing career. But I said, the real purpose that I found was during the building of Ryan House. And so I said, but I don't want to do this again from a grassroots level. I think we really need champions at the national level. If we're really going to help reframe the US healthcare system, we need to have conversations with federal legislators and centers of Medicare and Medicaid. And we need to have American Academy of Pediatrics and all the big national groups. And I want to be in that conversation. I don't have to be the smartest guy in the room, but I think I've got, at this point, the life skills from a professional career perspective, from my corporate marketing. I know how to set visions. I know how to pull people together. I've certainly got 17 and a half years of passionate caregiving experience with our own son, Ryan, and I've got a ton of passion for this space. What I need, though, is I need to be perceived as an expert.
Right.
So I don't want to just be on a parent advisory council because I absolutely believe in those. And I encourage all parents to get on advisory councils and give voice of your family and your journey to others that are trying to help make change happen. But I wanted to be at the table and I wanted to help facilitate this. So I decided that what I needed to do was go back to school and get a master's in public health. So I applied to some schools. This was pre-COVID. I ended up getting accepted to Johns Hopkins, Bloomberg School of Public Health, which is the #1 public health program. I said, boom, that's the one I want because I want a stellar education, but I most importantly want the ability to network. And I want to be able to open up doors with this education. And so did that program entirely on this computer, this gaming computer that Ryan and I built. And that's when COVID happened. And so everybody, COVID was bad for everybody, but COVID was perfect for me because I'd already decided to sequester myself in Ryan's bedroom here, doing basically an MPH program in 11 months. And I came out of that program and I said, okay, now what do I do? And it kind of was like the story of Ryan House, where people, these other communities across the country started to kind of connect with me. And it just became kind of an organic, hey, maybe now's the time. Maybe I'm the guy. Let's see if we can pull this national effort together. And so ultimately that led to myself and the people that were starting to kind of surround me and said, all right, let's start the National Center for Pediatric Palliative Care Homes, which is a mouthful. And so we really refer to it as the National Center or the National Movement. And it's really about let's bring some formality to all of these different community groups that are trying to come together. Let's really share learnings, best practices. And so we incorporated this national effort in September of 2022. We created a program brand called Children's Respite Homes of America, which is a lot easier to understand and to kind of embrace for basically our main marketing and communication effort. And we said, let's create this organization that has three main pillars of activities. The first is education awareness. Let's just keep talking about this and having opportunities like we're doing today, Lance, with you, about just bringing attention to these family stories, because it is less than 1% of kids, but let's talk about them more and understand the difficulty of these journeys and how we need to change the system. So awareness and education is our first pillar. The second pillar is advocacy, because we need to literally get in with my MPH degree now. We need to be talking to legislators and policymakers and regulators. And I'm really proud that in the 3 years that our organization has been in place now, we've actually already started to enact laws. So we've enacted the very first Pediatric Palliative Care Center healthcare license in Iowa. That has been signed into law, and we're now working to try and extend that over to other places, like hopefully someday in Michigan, because that would then give a house and a group in Michigan the ability to kind of do this. So advocacy is our second main pillar, and that's really our change the world kind of activities that we're doing. And then the third pillar is just community building. Let's make sure that the people out there that are trying to do these programs and connect don't feel alone, don't feel isolated. When my wife and I started Ryan House 24 years ago, there was nothing. We had none of this. All we had was our experiences that we were trying to bring from England. Today, a group in Michigan or Ohio or Georgia or California, there's a lot of resources and a lot of effort. It's a very different time in the world today than what it was 24 years ago. People are talking about these kinds of things at the children's hospital levels, and there are more policy people that want to talk about this. And now you've got a national center that really can help support growth of these kinds of things. So our goal is to ultimately get 50 homes in the top 50 markets in the next 5 years. That would be our awesome goal. Eventually, we want hundreds of these kinds of programs in the U.S. to support the million families that are going through these kind of journeys.
That'd be wonderful, Jonathan. That'd be tremendous. I want to kind of talk about the mission today. I know you've alluded to some of it, but what is the NCPPCH's vision and mission, and what role does the CRHA play in supporting these communities?
Yeah, so really what I would say is our goal is it's a professional organization that the mission is to scale, strengthen, and sustain children's respite and hospice homes across the U.S. So we're trying to create a national infrastructure here in the United States to support the growth of these programs, because there are very few. So we now have if you go to our website, childrensrespitehomes.org, we have a map of the United States. That map of the United States shows where all the communities are that are trying to do these kinds of programs. We have three colors on that map. We have blue dots, yellow dots, and green dots. The green dots are the houses that are actually open and serving families. Sadly, there are very few of those. You have Ryan House in Phoenix, which is the second one to open. You have George Mark Children's House, which is the one in Oakland, California. And then you've got Crescent Cove up in Minneapolis. Those three programs are very much the UK model of care and support, the overnight respite, palliative, and then end-of-life care through hospice. Then we've got four other green dots on the map. Those are community-based programs that also care for medically fragile children, that provide overnight respite, and then iterations on the theme of other kinds of services. Some of them do end-of-life care. Not all of them provide end-of-life care. So they're kind of iterations, but they're all part of our coalition. Yeah. Then you've got yellow dots, and there's a lot of yellow dots across the country. The yellow dots are the communities that have organizations, and there are some yellow dots in Michigan that are already formed as nonprofits locally. They're now in the process of raising money, forming boards. So anybody that wants to, if you go to that map and you see a dot in your area, you can get involved and join the board, help support and raise money, attend an event that they're doing to really help spread the word and help spread the awareness in the local community. So those yellow dots are working hard to raise the millions of dollars to ultimately put a shovel in the ground. They're also working hard on regulatory change, and that's where our national center supports them. So we're working with Colorado, and we've got a legislator already identified in Colorado to champion the law change. We're working with Texas to develop and get some bills introduced there. We're working with the state of Washington, with New York, and umpteen other places across the country, because that's how we're going to create a more of a sustainable business model for these kinds of programs so they don't have to rely so much on philanthropy. And then the third color group that you have is blue dots. And blue dots are the people that have just discovered this kind of model from hearing about this effort in the last few years. And they've come to us and they said, hey, we really believe in this. We want one of these in our community. How can you help us? And so the blue dots are the real pioneers. They're basically like Holly and Jonathan were 25 years ago when we were just starting out and we had nothing. Nothing but a vision and passion. And what we help the blue dots do is we're not teaching them about the journey. They already know that. They're either a bereaved parent, oftentimes, that wants to memorialize their own child through creating a program like this and naming it, instead of Ryan House, it could be Abby's House, or it could be whatever they want to call it. Or it could be oftentimes a professional that has worked and supported these families, like a nurse. A lot of times it could be an oncology nurse, a nurse that really spends a lot of time with kids with cancer, or a child life specialist, or a music therapist, somebody that really understands these journeys. The question that they end up asking us at the National Center is, how the heck do you start an organization? And so that's really the support that our group provides to those champions. Is we help them incorporate their organization. We've got articles of incorporation and bylaws. We talk about things about how to form a board, how to start raising money, how to champion legislative change in your market, and really provide the business side of support for this so that we can get this house open, stronger, and more sustainable than doing it yourself.
Yeah, absolutely. And, takes a village, right? I mean,
oh my gosh, yes. It's hard work.
You and your wife had the vision, you had the passion, but, you needed that support at some point along the way to be able to realize that vision. I want to talk about it, though, because it kind of ties into this next question, the barriers to care. Why are there so few children's respite, palliative, and hospice care homes in the United States? I know you've mentioned quite a few reasons. And how does licensing and reimbursement issues hold people back?
In the United States, the reality is that, as Americans, or nobody likes to think about that children die. The reality is children do die. We can't save all kids. Some kids have rare diseases, et cetera. In the United States, there are about 45,000 children every year under the age of 21 that will die. Half of those generally are from a traumatic event, a car accident, an accidental gunshot, or something that was not expected to happen. But the other half of those kids are really dying because of a significant medical condition. Those are the families that really our programs support. And those are the families that are on these longer journeys. Some of those journeys may be short. I mean, it is possible that a child will be born and not live very long, maybe days, maybe weeks, maybe months. When the child becomes, is a lot of the neuromuscular diseases, the children may live into their, 7, 8 years old, 10 years old, 15 years old. Those families have been supporting that caregiving for that child for a long time, and those are the ones that really need the break. The U.S. healthcare system, as we said, is really designed for adults, and so there just is not a healthcare license. So, for example, Ryan House in Phoenix is licensed as a hospice, which from a business perspective, works out well when a child comes to Ryan House for hospice or for end of life care, which is about 20% of the usage of Ryan House. Ryan House is able to bill for that care because it is licensed as a hospice. So it can help get support financially from the Medicaid system and from insurance. But when a child comes to Ryan House for respite care and the child is not recognized as hospice, because hospice is really in the US recognized for the last 6 months of life or the last year of life. Well, when was my son never not in hospice? Basically, because he was not expected to live to 2. He lived for 17 and a half years. But yet, my wife and I and the medical professionals, we never classified him technically as hospice. Therefore, he was never able to get hospice benefits. And so when Ryan House provides respite support for a child, they can't bill for that because they're licensed as a hospice. So that's why they raise $3.5 million a year. There are other, we have a program in South Bend, Indiana that is licensed as a specialty hospital. And it's just a very convoluted kind of license, but that's what they've been able to duct tape and band-aid together to make it work in Indiana. There's a house in California, George Mark Children's House, that is licensed as a congregate living facility. That was really a holdover from the AIDS epidemic. And so none of these things are really designed efficiently for this kind of care model.
Right.
So our vision is we wish, if we had a magic wand, we wish that there was a pediatric palliative care center license that would umbrella this kind of care. You could do everything that you wanted to do at a Ryan House, provide emotional support. The families that are on these journeys, one of the hardest things is to find joy in a journey like this, knowing that your child is going to die. You just don't know when your child's going to die. So my wife and I went for years thinking Ryan was never going to live to 2. And then he did. And then he celebrated his 3rd birthday and then his 4th birthday. But it's not like, oh, yippee, we're through this. Now he's going to be an adult. It's like, no. Every day was like, is this going to be the next time we're in the emergency room? Is this going to be it? Are we going through end of life here? When Ryan House started and when it opened its doors in 2010, we never thought Ryan would be alive when Ryan House opened, but then Ryan was, and he and his older brother were able to untie the ribbon to kind of or the rope to open up the official Ryan House doors. And so we need to go in. It's not only the licensing, but it's also the way that Medicaid and insurance reimburse professionals for this kind of care. I believe that policymakers and regulators want to have this conversation. They're not denying that this exists. The problem is there haven't been people to actually have this conversation with them. And I think that's the exciting thing about what we're doing right now is that we're actually bringing this conversation to policymakers. They've been very receptive. As an example, the law that just passed, we got the first in nation pediatric palliative care center license enacted into law in Iowa called Mason's Law. Mason was a young boy that died, and his family, Shanna and Curtis, are starting Mason's Lighthouse, very much like a Ryan House in Iowa. Well, Shanna was able to present our vision of a pediatric palliative care center license ultimately to the House legislators, and she was able to have a meeting with the governor. The leaders in Iowa said, you're right, we should do this. We need to support medically fragile children better. Let's write a bill. So Shanna then reached back out to me and said, hey, they want to write a bill. So we drafted up bill language. We got into the weeds and the details of how this would actually play out. We presented that back to the House legislator. Long story short, this bill was introduced into the House in Iowa, passed unanimously, not a single nay vote. This is not about Democrats or Republicans. This was a very apolitical kind of situation. This is about kids and families. It then moved to the Senate, passed unanimously in the Senate, and the governor passed it also. So this has nothing to do with political parties or anything. And that's what I think is exciting about the kind of the work that's happening right now, is that what we need to do is get the conversation in front of them, and then they're willing to have this conversation.
Absolutely. I know, Jonathan, we're coming up towards the end here. I just got a couple quick questions for you. If we look at the CRHA map and the 41 programs across 28 states, what does that tell us about the state of the movement right now?
It's very exciting. I mean, it's I kind of almost, and I'm the one doing this, but it's kind of like herding cats a little bit because these groups are these are passionate leaders that are trying to create their programs, and there was never really an intent to be connected through a national effort. So as we've now created a national umbrella, they've been very excited and eager to kind of link into it, but it's still early days. So we're working hard to sort of share information. The energy level is really high. We know that we're not going to change this world in weeks and in months. This is really going to take us years. But the fact is that our national center has already been in existence for coming up on 3 years here in about a week. As you said, we have 41 programs across 28 states. We do now have a national footprint, which is also exciting because we're having conversations with national foundations and national corporate opportunities to say, look, if you want to get behind this like they did in the UK to really help stimulate and encourage this kind of momentum, we've now got an infrastructure to do this more efficiently. You can help connect with the National Center through childrensrespitehomes.org. You can find our contact information there. You can learn more about us. You can learn about the National Center and what we're doing there. Connect with us. And that's what's really going to kind of fuel this growth. So I think we've come a long way in the last few years. And it's just very exciting, but it's still going to take a lot of work and a lot of years to make this all happen.
And all things do, though, that are worth it. And I look in, just listening to your story, this is the second or third time we've talked now. You and your wife 24 plus years ago probably couldn't have imagined the progress and where you guys would be present day, right? And would you say it's easier now to make that kind of progress than it was 24 years ago? Or was
100%. Yeah, I absolutely believe that. I truly believe that if there is of the programs that we're already working with, there is not only do we have a clear vision of what these programs look like so when people come and visit a Ryan House or a George Mark or a Crescent Cove or others, they're like, oh my gosh, there are places in the United States that they can come visit, see, and go, yes, we need one of these in our community. So you can touch it, feel it, and see, talk to the teams, understand the family benefits. Fantastic. We also have a clear vision of sustainability at this point. So Crescent Cove has a business model where they've changed laws in Minnesota. They've raised the reimbursement rates. They now have a sustainable business model that is what we really grew upon in Iowa to enact the law to make it even more efficient. So we've got now state precedences that we can now extend over to other states. So the tactics and the tools that we've got are just getting stronger and stronger every day. This absolutely can happen in your state now.
When, one of the things I would mention about Michigan, and I've mentioned it several times on the show previously, with our home care company, there is no regulation, there is no government oversight, there's nothing to prevent anybody from coming to Michigan and starting a home care company. You can hire anybody you want. There's no guidelines, and I think that's very unfortunate for numerous reasons. And it sounds like it's similar with this situation. How long, I know you guys got Mason's Law enacted in Iowa. How long would you envision it to take to get something like that enacted in Michigan so that you can get these homes established and get reimbursements up and things like that?
I'm a big believer in luck and kismet. The pathway in Iowa literally happened in 2.5 months. It was that fast because from Shanna's opportunity through the executive director of Make-A-Wish is the conversation that led her to the legislators and the governor's office. From the moment that started to then when the bill was enacted and signed by the governor was 2.5 months. That is crazy fast. We would love that to happen. It may take a cycle or two of a legislative process in a state to kind of make this happen, but there's no reason why this has to take 5 years or 10 years. This definitely can happen if groups can get organized. We can make this happen in the next year to 2 years, kind of a thing through the legislative change. Now that the bill is enacted in Iowa, though, that's the license. That's not the end of the story. That's really still a major milestone. It's still at the beginning of the story because now what we have to do with that license is now turn the conversations over to the Medicaid and the funding sources of that to connect the funding to that license. We couldn't, raise the rates of Medicaid reimbursement and insurance reimbursement until we had a license to connect it to. So we had to kind of get the license solved first, and now we can connect the reimbursement rates because we need rates at the $2,000 a day kind of levels to really support this long term. But that is what's happening in Minnesota. So we've got state precedences now to make this happen. So it's like I said, we've got all the tools. We've already got a legislator that we're talking to in Colorado. I just was talking to yesterday, the state of Washington has a attorney firm that wants to help push the bill movement in the state of Washington. We've got aggressive people down in Texas that are trying to do this. So it's just, we will help support and go wherever the energy is. So there are people in Michigan that are interested in doing this. What I need from a local community is I need passion and energy and willingness to want to do this. Yep. And then they connect with us, and then it's like, yes, we can help you, and let's make this happen. So childrensrespitehomes.org is really the place to go for next level of conversations. And I love talking about my son, though. He is clearly my North Star. He is definitely, I think about him all the time. His life and even his death have been just very much the fuel that drives what I do today, and I love him with everything.
Yeah, no, I told you when we first talked, I have 3 children, cannot even imagine going through what you guys went through, but I can imagine I would probably be doing exactly the same thing that you're doing. And, I just commend you, and we want to be there to support you guys as any fashion and however we can, because I told you before, this is something we're very, very passionate about. And, there's some way we can assist. All you got to do is let us know, Jonathan. And I just want to close here and again, have you share with our listeners and viewers again where you would like them to go to get involved, and we'll get it up on the screen and have it in the show notes as well.
Yeah, I appreciate that. I think the easiest way and the most memorable way is just to go to our website, childrensrespitehomes.org. And through there, you can see the map. You can also link back over to our main organizational page, but that's a little bit more National Center for Pediatric Palliative Care Homes. The easiest thing to remember is childrensrespitehomes.org. That's the first best place to kind of contact us. We'd love to have continued conversations.
Fantastic. Well, Jonathan Cottor, thank you so much for what you're doing, and all these families that are, out there that need our support, that need the resources, and we need to get these homes established. So anywhere you are, there's a home to help support you on your journey and your children's journey. Thank you, Jonathan, and we look forward to continuing the conversation with you guys.
That sounds great. Thank you so much, Lance. I appreciate it.
Have a great day.
Thank you.
Thank you for joining us today here at All Home Care Matters. All Home Care Matters is here to help families as they navigate these long-term care issues. We invite you to visit us at allhomecarematters.com, where there's a private, secure, fillable form where you can give us feedback, show ideas, or if you have questions. Every form is read and responded to. And remember, you can listen to the show on any of your favorite podcast streaming platforms or watch the show on our official YouTube channel. Just make sure that you hit that subscribe button so you never miss an episode. We'd also like to say thank you again to Jonathan Cottor for joining us today. We look forward to seeing you again here at All Home Care Matters.
Thank you for joining us today. We look forward to you joining us again on another episode of All Home Care Matters. To learn more about the show and to connect with us, visit us at allhomecarematters.com.